Hello, hello.
Welcome back, everyone. Welcome back to the channel, Getting That Medical Degree. So we're going to talk about Naplex review. What is today's topic?
Today's topic is schizophrenia and psychosis. So, again, your NAPLEX probably won't ask you much about this topic, but it's important to cover it just in case you do ask like one or two questions about it. So let's get into it. Symptoms. Negative symptoms is like lack of emotion, social withdrawal, loss of motivation, lack of speech. Then like positive symptoms are more like what you think of when you think of schizophrenia, so like hallucinations, delusions, disorganized thinking and behavior. I could see the test asking you questions like this, like what? Here's a list of symptoms. Are the select all that apply that are positive symptoms? I could see that being a question. It's because that's kind of simple to answer, but kind of annoying at the same time. So I don't know. I just how they like doing the test questions. So with these type of patients, you have different drug formulations that you usually want to use. So schizophrenics are kind of skeptical about medications, and they will actually put medications in their mouth. You give them a medication to take if it's a pill, and they'll actually hide it in their cheek so you can't see it when you check their mouth, and then they'll spit it out when you're not looking. That's what's called cheating. And to prevent that, you want to use like long-acting injections, or you can also use like ODT, which is like oral disintegrating tablets, which help prevent cheating. You can use solutions, which is like liquid for children, and you can use for children and people who have PEG tubes or injections as well. Some tidbits that might be important. Anticholinergics are used to prevent dystonias. Don't give Zyprexa and benzos together. If you fail two or more antipsychotics, you can use clozapine or verclozapine or reverse cloz. That's really about it for that. First generation antipsychotics probably won't ask you much about these, except maybe Haldol. But it's known that the low potency cause more sedating than the high potency. That might be the only thing they might ask you there. Black box warning for the high potency, such as like Haldol or haloperidol, dementia-related psychosis, and increased risk of death. So just by taking Haldol, you're more likely to die than someone not taking Haldol, which is crazy, but that's its risk. Warning, so like QTC prolongation, anticholinergic, EPS, so if they have Parkinson's disease, you probably don't want to be giving them one of these. Also causes sedation as well. So if they're probably elderly, you want to avoid anything sedating an elderly most of the time. So second generation, Aripiprazole, which is a Abilify, comes in also injections. So Maintaina is a once a month injection, or you can get Aristata, which is a every 1 or 2 month injection. Clozapine's Clozaril, it's usually not really used for the third or pretty much third or fourth line. It has a REMS program, which usually means the doctor has to sign up for something at their office. The pharmacy has to agree to a contract thing as well, and the patient also has to sign like a thing as well. It's a big pain for everyone involved because it's very like high risk drug, so there's a lot more precaution with this medication. It can cause seizures, constipation, weight gain, and increase your blood sugar and your lipids. The main thing is the neutropenia and agranulocytosis. So you want to get ANC checked before you get it. ANC has to be greater than 1500, and you stop it if it's less than 1000. Again, the Naplex is testing you in dangerous stuff, so this is a medication that you really need to know for your test. This is why I went more detail with this medication than the others. Uh, so you start the medication, and you want to check your ANCs every week for 6 months when you first start medication. After that, it's every 2 weeks for 6 months, and then it's monthly. That's something for you to know. Also, you know which drugs are injection and which ones aren't. So, Abilify, make sure you know the injection names and how often they're dosed. Lurasidone is Latuda. You want to take it with food, know that. That's why it's included in the slide. Greater than 350 calories. EPS and nausea and weight gain, possibly. Some other ones as well for second generations. Paliperidone has also an injection. So, Sustenna is once monthly, while Trinza is every 3 months. Increased prolactin is the main thing to know there, and EPS. Quetiapine. So it causes weight gain but has low EPS. So if someone has Parkinson's disease and they have like psychosis issues, quetiapine or Seroquel is actually the preferred medication there. They want you to advise your patients to take it without food or with light meal. A light meal is less than 300 calories, so it's probably better off just tell them to take it without food. So there's that. And you also have risperidone, Risperdal. Consta is the injections every 2 weeks. It can increase the prolactin, so make sure you know that. Ziprasidone, Z sound is like kind of like I don't know. I don't know what's going with that one, but it can cause QTC prolongation. Take it with food. It also comes in an injection. Then Saffris actually comes in a sublingual tablet, and it can cause tongue numbness, which doesn't sound too pleasant to me. And it can also come in a patch. It's only actually one that has a sublingual tablet and a patch. Probably important for you to know, just in case they ask you about which one comes in the sublingual tablet. Cardive Dyskinesia treatments is valbenazine or deuterabenzine. They both can cause like somnolence, and the second one, hepatic impairment, contraindication in. So watch hepatic functions. And then neuroleptic malignant syndrome due to a D2 blockade. Signs and symptoms: hyperthermia, muscle rigidity, and basically a sudden mental status change. So this is usually caused by antipsychotics. So you want to taper the antipsychotic off as quickly as possible, but you have to be careful with these as well. So probably read a couple guidelines, make sure the guidelines match up, and then go from there. You can relax your muscles like with like benzo or dantrolene. It also cool the patient down. So that's about it for this chapter. That's really about it for all the psych stuff, since everything psych is pretty much done now. If you guys have any questions, leave them down in the comments below. Comment, like, subscribe, and let's know if this is helpful. Any comments, Mitchell? We'll see you guys in the next video. Peace.